everyone. It's a brand new episode of Doctor in the House. My name is Chris Carter, and I'm excited to be here with you today. And if you're just joining us for the first time and you're wondering what is Doctor in the House all about, I always say this is the consultation before the main consultation. It's that show where we get to talk about everything concerning your health. We get to speak to a doctor about a particular topic, and he breaks it down to us. We also give you the chance to ask your questions, and he gets to answer it. That's why I always call it the consultation before the main consultation if you have to go to the hospital. All right, so the doctor in the house today is Dr. Simon Kwatin-Baidu. He's a neurosurgeon at the Bank Hospital. And today we are going to be discussing something that a lot of people go through. Does it come with age? Does it come with our sitting posture? And how bad can it be? And how worse can it get? Anyway, we're talking about back pain and the management of back pain. So if you have any question concerning your back pains, if you're going through any back pain right now, just let us know via the WhatsApp number on the screen, and the doctor will get to answer all your questions. All right, so let's get straight into it. Hi, Doc.
Hello.
How are you?
I'm great.
You're
Yourself?
welcome.
How are you doing?
I'm fine, thank you. Doc.
Okay. Thank you so much for having me here.
All right.
It's a pleasure, and we hope that our conversation will be quite educative for the general public.
Yeah. All right, so let's get into it. Back pains. A lot of people get back pains. How does it start?
Okay. So for us to be able to talk about back pain, I'm a neurosurgeon, so we will take it from a neurosurgical perspective. There are back pains which more or less come from orthopedic nature, vascular nature. You could have it from even renal function, or when I say renal function, I mean renal conditions like stones and bladder.
That's the kidney stones.
Yeah. So now we are going to concentrate more on the spine.
Right.
And your question was, how does it begin? Well, for statistics, let's begin with that. 4 out of 5 people would have back pain in their lifetime. So
4 out of 5?
5.
That's a lot.
Yeah.
It's almost like everybody.
Almost like everybody. And why do we have that? Now, because of our way of life, even how you're seated now, your posture is something that's going to give you postural pain.
Oh my God.
So you're
So
going
the
to
way
have
I'm
like a
sitting
back.
right now, it's a problem. All right, so how do I need to sit?
No, you need to sit as I'm seated. Sit upright, make your back straight.
And put my leg
That's
like that?
Yeah.
Okay.
That's one of the basic ways we could start by
So do I need to
helping
lean?
our patient. No, you should make your back straight.
My back straight,
Yeah.
okay.
That's the most important thing.
All right.
Because majority of the problems we have with the back pain, they are wear and tear of the spine.
Wear and tear?
Yeah, that's we call spondylosis. Right, that's just the basic explanation for our viewers to be able to get it. And it comes mostly also as a result of aging, what we do, our lifestyle. In Ghana, you see we have something which is quite common, like head loading. We carry things on our head, we lift things
on the head, yeah.
and these are all things which lead to we having back pain.
So how does the carrying things on your head actually affect the back? That's your
Okay.
head, and that's the back right there.
So let's look at the spine as a structure, right? The more you put a lot of load on it, the more it's taking the load. So the load increasing is what causes the problem for the spine.
Wow.
And we have people, let's say, people who sit for long, like drivers, let's say these auto mechanic guys who lift engines and all those things. They are lifting things and they're supposed to use equipment to lift them. Unfortunately, we do it manual because in our part of the world, we do not have a lot of sophisticated equipment. So we do these things and we come back.
Right. So talking about heavy loads, most of us go to the gym, and right now it's been said like, oh, try to lift, it helps you, it helps you in different ways. Now, lifting also requires heavy loads. So will that cause us some back pains? And if that will do, what are the right ways that we should, what are the right things we should do when it comes to lifting?
Okay, so first things first, to go to the gym, I think it's quite an important step every one of us should be doing. You get healthy. And there's a technique for lifting. Some would require you to bend your knees before you lift. And you also have to know the weight you are lifting. You shouldn't be taking more than you can bear, right? So these are the basic things which kind of contribute to we doing things that exceed or cause problems for us.
Right. So what other factors are we looking at when it comes to what causes it?
Oh, there are so many factors. So with back pain, we could just classify as musculoskeletal. That's this the strain of the muscles at your back. We could also consider pathological issues. That's why we have disc herniations, we have lumbar canal stenosis, we have tumors, we have fractures, we have something called spondylolisthesis, when the vertebral bodies kind of move out of their place. These all cause back pain. But generally, these are the common ones we face or we see. There are other conditions like DISH, a disease whereby there's hypertrophy of the back muscles, and they require us to take care of ourselves in that way.
Now, from the neurosurgical perspective, what are some of the type of back pains that we notice? Do they have names to it, or they're just generally just called back pains?
Well, it depends. If you just want to, like I said, postural pain, like you were having, it's as a result of being in a specific posture for long. There is a common word that's on the street, like sciatica.
Sciatica.
Well,
so the sciatica, is the postural thingy?
No. Sciatica.
Oh, that's another one.
Okay, so sciatica is actually from the nerve sciatic. It's one of it's the longest nerve in the body. It forms from L4 to S1, the remi of it. And it actually, when it comes, it's a discomfort from like your lower back into your legs. And that's why most of people say, oh, I have sciatica, I have sciatica, I have sciatica. Mostly when it comes, it's also as a result of pathology at L4, L5, or L5.
What does that mean?
It means that
that's
the
such
nerves,
a medical term.
No, I'm trying to go as simple as well. That's why I'm using certain things. But it's just compression of the nerve roots around the L4, L5, and the L5, S1.
Yeah, but how does it connect to the leg?
Okay, so take it as electrical wiring. So it's more or less like a continuation of, let's say, our brain, then we go to the spinal cord, then it gives roots. So the roots pass through foramens, and they pass through our legs. They give sensation, they take information from our legs back to our spine. And that is why when you have a pain from your back, it kind of moves through. It's like electrical wire, it takes information.
Right, and how common is sciatica? And apart from that, does it come with age, or it can happen at any age?
Normally, we see them in patients who are more than 40 years.
More than 40.
But now we're also seeing them in young adults. I mean, it's also dependent on how people take care of themselves.
So what can cause it?
Oh, it's just compression of the nerve roots. And that is because a disc might have probably moved out its place, or somebody has put on so much weight that is putting a lot of pressure on the spine itself, causing movement or spondylolisthesis, or even trauma causing that.
Can it be fixed?
Yes. Majority of the cases it can be fixed. And the interesting thing is in around about 80% of the cases, they don't require us to do even surgery. They can just come for medication, physiotherapy, or an epidural steroid injection, and they really do work.
And it goes back to,
No, the disc doesn't go back.
It doesn't go back, it's just about managing.
It's just about managing.
So we can't put the disc back?
No, it depends. Some of the discs would require us to go do surgery, do something called microdiscectomy. Some would require us to do just conservative management, and they will still do well.
Okay. Interesting. And there's another one called spinal spondylosis. What is that?
That's why we began by saying that it's more or less like a word. Spondylosis is actually a Greek word. So it's just as we grow older, we have some degenerative changes happening in our body, and this also occurs at the spine level, and this is what normally we call the spondylosis.
But can it be can it be avoided? Like, can you do things that will make you not have spondylosis?
Well, yes and no. And why do I mean by that?
Like supplementing? Like
no, I'm coming. When I say yes and no, there are things you can do that may reduce the possibility of getting a spine condition. I think not everybody in life goes through this back pain issue we are talking about. There are some people who may not have it throughout their whole life. But majority of us would have to encounter it. And how do we manage it? We just manage it by taking care of ourselves. Like we said, with the posture, with the gym, with the eating. If you begin to experience this back pain, it's quite imperative that you come to the hospital as quick as possible so that we're able to neurologically diagnose you. In most cases, people go to other places, and when they come back, yeah, they come back worse off, and it's quite complex
Wow.
to fix such things.
Wow. I'm smiling because sometimes when my back hurts, I just go for a massage.
Oh, but does it help?
It helps.
Yes, so it could be as a result of musculoskeletal pain that you're
Right.
having. That's the distress of the back muscles. And these ones will go. But if it's more pathological, if it's a disc, or it's a tumor, or it's an AVM, or it's something else, we'll have to look at it.
Right. So now talking about, all those things that you just mentioned, at what point should we tell ourselves, you know what, this is more than a mere muscular, thingy going on, that it could be serious? What are the symptoms that will let us know that, you know what, nah, I just can't continue this massage thing again, or I probably just can't continue just by cracking my back? Because sometimes we have this behavior of people just cracking your back for you because of what we see on the internet. Do you understand? So at what point do we say, okay, no, let's go to the hospital?
Okay, so when you have a back pain that is more than 2 weeks.
More than 2 weeks?
More than 2 weeks. Let's say you've been taking these ointment deep heat and you still feel like it's in.
Yeah, I had
Then
to
you
think.
have to really go. And the issue about going to places for massage is a good thing. But the most important thing, we have to know what is really wrong with you.
Inside, yeah.
Let me give you a practical example. If you have a spine tumor, right, or you have a vertebral body which has been destroyed or compromised, and you have somebody trying to align it, not knowing what is actually there, I think that they will end up doing more harm than good. So if you see a doctor, you do the imaging, you are assessed for some time, and you come to a point of conclusion with the doctor that this is something that will require you to do massage, then it's far. That's a good thing to do.
All right.
Rather than that, just going to places for your spine to be aligned, to be massaged, I think it's something that the general public should look at it critically, because at the end of the day, you end up getting yourself anywhere. There are other signs also one should pay attention to. When you have persistent pain, normally we grade pain on a scale of 1 to 10.
Right.
So 1 being the lowest, 10 being the highest. So persistent pain, which is more than 5, it will require you to seek prompt medical attention.
Right.
And we just say back pain. But sometimes you can have the back pain and you have weakness in your legs. The powers in your legs will be very reduced. Sometimes we have conditions where people will not be able to urinate or even defecate, constipation and all those things. These
From
are
a
what
back
we call,
pain?
Yeah, we call red flags. So when these things come...
From a back pain?
Yes.
You can't urinate and even use the toilet?
It's because there's compression on the nerves.
Oh.
And when there's that severe compression, you need urgent medical attention.
Wow. Wow, wow, wow. Now, as a neurosurgeon, I'm sure there are people watching you right now that are probably in medical school and maybe even studying neurosurgery. How do you actually diagnose the, cause of a back pain? Okay.
So when a patient comes and talks to us about back pain, the most important thing for us to know that whether it's neurological or it has another pathology. So if we do something called clacking, you examine the patient, you're able to find out what is actually wrong with the patient. Then you step up with imaging or sometimes some labs. And based on the imaging, that's why you're able to take a concrete decision whether to do conservative management, put medications, to do epidural steroid injection, or to think of surgery.
We're talking about epidurals. When we talk about epidurals, it's for women in labor.
No, this is a different
it's for
type
women
of,
in labor.
It's a different type of epidural.
Okay.
The one women have at labor, it's more or less like short acting, so that it's done for the patient and you deliver. But this one is able to stay and give a better relief up to sometime up to 6 months, sometimes
up
even
to 6
more.
months. Oh wow!
Yeah, to relieve that.
All right.
But it's a temporal
and
measure.
it's the same way. I mean, the same way.
It depends on how it's given. Some can go a little bit lower. Around a place called sacral hiatus, we inject it there. It depends on where the pathology is and how you are being guided.
Now, let's talk about our beds. Do our beds contribute?
They do. They really do. They really do. One of the things that we should really pay attention is how we spend our evenings or our nights. When we have good beds, at least we're able to wake up without feeling back pain or stressed or all those kind of things. So our beds should at least be firm. And it's not only about bed, it's also about the chair you use at work.
The chair you use at work?
Yeah. Because if you don't have a chair that supports your spine very well, you end up working for an institution or organization for that long, and later, as you're going on pension, you're going back with back pain. And we see a lot of patients in the bank hospital who come, they are mostly sedentary workers, they sit for long hours, they come and we have to help them get better.
Wow. That's interesting. And what about our pillows? Do pillows also contribute to that?
It depends. I mean, some have orthopedic pillows, which are quite essential. But
does everyone need an orthopedic pillow or an orthopedic mattress?
I wouldn't say everybody needs it, but if you have it, it's a good thing.
Right. All right. And do kids get the same pain, or it's only, say, adults?
It depends on the pathology presenting. Let's say there is a pathological AVM. Right. If it happens in the back for a child, it could also mimic those things. But majority of these back pains are as a result of age-related wear and tear degenerative process occurring, and it comes with adult, like about 40.
Right. So in all your years of practice, has it been more of managing the back pains that are presented to you, or it's been more of surgery?
The truth of the matter is surgery. About 15 to about 20% of our patients require surgery.
Okay.
Majority of them require
just
conservative management.
Is management expensive?
It depends on the pathology at present. Because if it's just a normal back pain and it wouldn't require surgery, medications can be rating, physiotherapy can be encouraged. In the extreme end, an epidural steroid injection can be put there.
Right.
And we observe the patient for some time.
Right. What about nerve blockers?
That's something I was talking about, the epidural steroid injection.
Oh, okay, so epidurals, whatever is a nerve blocker.
Yeah.
Say it again, epidural what?
Steroid injection.
Epidural steroid injection, so it's a nerve block.
Yeah.
So basically you don't feel the pain again.
Not that you don't feel the pain, it's more or less like a temporary relief for you to be able to.
So that's it, right?
Yeah, that's what we do.
So are we going to do, okay, I'm just saying, if I have a back pain that requires it, am I going to be lying down or sitting?
It depends. Some can even lie prone, just to lie down like that. And some would have to lie this way. Some can be sitting. It depends on where the pathologist actually
right.
located.
And is it also, do we also give those instructions of don't move, you have to be straight up, this can happen to you, you might get paralyzed, you might get this. Is it the same instructions?
I wouldn't say it's the same instruction, but at the end of the day, if a procedure is being done at your back, you should remain calm so that we do it. And it's not so complex like.
So if I'm scared of injections?
Oh. But comparatively, the pain you are facing and the fear of injection, I think you would choose the injection over.
Well, that's true. Yeah.
Because there are some people who come, they are crying. And a patient came to see me from Sierra Leone.
From Sierra Leone? Yeah.
With severe back pain. After the injection, she came with a walking stick. After the injection, she was able to walk. Her pain had really gone down. And she was able to go. Wow. So I think that in all honesty, I mean, it's the first step to surgery when we feel like you will need a surgical intervention. We do that.
Okay. Well, it's nice to hear that this can actually be managed. But before I let you go, are there any final words that you have for us on maybe the right things we should do to avoid or prevent any of these?
All right. So as we've already started talking about this, then I think early diagnosis is key here. And it's very important that when one has this back pain, to see a doctor or a specialist consult so that you'll be assessed first.
Right.
To be going around other places, taking medication, doing all sorts of traditional medicine. I really don't know the components of what they give them. But what we've realized that they come back worse off.
Worse.
Yeah, so you have to think about your own health, that this is you. This is something quite important. So if you want this thing done, why don't you get somebody who will be able to help you? Then afterwards, if you want a second opinion or other place, that is fine.
Then you can do your own thing. Yeah. So now, before I let you go, I see some, positions and exercises that we can do. Let's go back to lower back exercise, pain exercises. Do these work?
They do work. I was supposed to have come with the physiotherapists, but they do work. And we believe that mostly these ones, they work when you have muscle strain. Muscle strain, they kind of work.
Yeah.
The extension exercises are able to work when you have stenosis and sometimes disc herniations. But generally, they work. They just provide a temporary relief.
Yeah.
The exercises themselves come as a part of the treatment modality.
For
That
physio,
is,
especially
yes.
physio.
So you're taking medication, then you're also doing the exercise.
Yeah.
So the combination of these two, that is going to give you
Right.
the best
So,
result.
yeah, so let's do the sleeping posture.
And the sleeping posture. We know that we all don't sleep like the way that's.
Oh, they say don't sleep on your stomach.
No, I'm not saying that.
I'm a stomach sleeper.
It doesn't really matter. I'm just saying that we all don't sleep as shown here.
Yeah.
But if one begins to have those back pain, then there is important that from there you have to know how to sleep. That is what it actually means. It's not necessarily that you have to go sleep like that.
Okay, so looking at this, if I have a back pain at the lower back there, the right thing to do is put a pillow, like.
Yeah, that's what I'm saying. It depends on the pathology. You just don't look on the internet, see
And
images
just see
and
these
begin.
things, yeah.
You go to see your doctor, you discuss, because the main reason why you are sleeping this way is because it is going to release the pressure at your back to make you feel better.
Right. So it
that's
all
the main
depends on where it hurts.
where it hurts
Oh, okay.
and what's supposed to be done.
Right.
Because some patients are even not told to sleep in any posture. They are given corsets.
Corsets.
Some for the neck, collar, some for the lumbar, and it helps them.
Yeah, my mom has a lumbar one.
A lumbar corset.
Yeah.
Okay, for back pain.
Yeah.
Yeah, so it all depends on what you're
Right.
coming with.
So what about the sitting posture?
Okay, so as it's clearly stated there, you just need arm rest. You just need your neck and your shoulder straightened. And it
My
should be firm.
producer actually sits this way. They especially the incorrect posture. Yeah, Dede does this a lot. Yeah.
Dede.
Yeah. Dede Davis. Yeah.
Oh.
This is her position.
That's hard.
Oh, yes.
But,
so if she doesn't take time, in some years' time, she'll be coming to you.
And
But now they are here, so we will try and correct it.
Okay.
Yeah.
And also is the chair.
The chairs.
yeah.
The chairs always have to
Yeah.
have an armrest.
Not necessarily like
Okay.
that, but if you have it, that's great.
It helps.
There is this chair called Secret Lab.
Secret.
Lab. There are chairs which provide or help with our body posture, and I think that if people work in offices, they should actually have good chairs to sit on.
Right. You see how I'm sitting like a robot now? Because
No, you're not sitting as a robot. I think you're taking care of yourself
because
very
you
well.
told me that I could actually be hurting myself. All right, so ladies and gentlemen, there you heard it. We're talking about back pain and its management, and I'm sure there are a lot of people that are going through this, and Doc has just broken it down to us. But Doc, how can people reach out to you?
Okay, so normally I consult on Tuesdays and on Fridays at the Bank Hospital from 8 to 1
Tuesdays
p.m.
and Fridays.
Yes. So if anybody has any, not only back condition, neurosurgical condition, they can always walk in, and we will provide the best service we can for such a person.
All right. Thank you so much.
Thank you
So,
so much.
ladies and gentlemen, this has been the Doctor in the House, and the Doctor in the House has been Dr. Simon Kwaten Beidu, who's a neurosurgeon at the Bank Hospital, and my name is Chris Carter. See you next week at the same time right here on Channel One TV.